Welcome to Pennsylvania in Focus. I'm Anthony Hinnon, Pennsylvania reporter for the Center Square. Today we are talking about proposals for medical debt relief. Joining me today is the Center Square's Pennsylvania editor, Kristen Smith. Kristen, we have what's looking like a proposed bill in the General Assembly that would create a Department of Health program to discharge debt tied to medical visits. What can you tell us here?
So it's a Democratic-backed plan that dovetails with something that Governor Josh Shapiro also supports, which is for the state to buy medical debt very cheaply and then turn around and discharge it for thousands of residents. So this is actually House Bill 78. It would create a new program in the Department of Health. And so it would apply to residents who have bills that are worth at least 5% or in excess of that of their total income, or they live at or below 400% of the poverty level. So if you translate that into actual salaries, that's about $60,000 a year for a single person and about just under $125,000 for a family of four. So it's a lot of people who would be impacted by this legislation. It was spearheaded by several reps who have medical backgrounds. One of the important things that they note is that this isn't an issue that just impacts people without insurance. I think that's a misconception that a lot of people might have. 60% of people with this medical debt have insurance. It's just a matter of, what their insurance coverage, how far it goes, essentially, and how one small injury can snowball into debt that is hard for them to claw their way out of.
So, and when we're talking about discharging medical debt and buying medical debt, this is not a one-to-one thing. This is right. This is not if the state would buy $40 million of medical debt, then they discharge $40 million.
Correct. So medical debt is actually sold at the cost of 1 cent on the dollar. So that means that when debt collectors pick it up, they pay a very small amount for it, and then they turn around, demand repayment with interest. So that's how they profit. So the state wants to go in and buy that same kind of debt. So let's say they bought $4 million, like Shapiro's plan. They could discharge $400 million for residents. So you can see the disparity there in what it actually costs versus how far that money could go for residents. It's not the first time that this kind of program has been implemented in Pittsburgh on a smaller scale. They did something similar. The city council, they eliminated $115 million in debt for 24,000 residents, and they only spent $1 million to do that. So this does have some precedent, some proof at a smaller level that it does work. So now it's just a matter of getting it through the legislature. It did pass the House back in June on a healthy bipartisan vote, 114 to 89. Given our current split, that's a pretty good buy-in from Republicans who are not always in support of this issue. So it's unclear in the Senate how quickly or how far this will go. But for now, this seems to be the broad contours, to use the governor's language, of what they would like to do with this medical debt issue.
How big of a program would this run? I mean, have legislators thrown out a number on this just yet?
So I think they're sticking with the governor's idea of let's spend $4 million and get this $400 million in return. Of course, we're in budget season, so there's lots of priorities that lawmakers have that Shapiro wants. And of course, we have the delicate balance between the House and Senate as far as giving leeway and kind of horse trading what's going to make it in there. So will this $4 million investment or even smaller or more make it into the final plans? It's unclear at this point, but it's definitely something that we're going to keep an eye on, as this has a very broad impact for thousands and thousands of residents who are living with medical debt and are struggling not only to pay it back, but are also hesitant to get more care when they absolutely need it because of the existing debt. In fact, one of the Representative Bridget Kozarowski, and I apologize right up front if I'm saying that wrong, she's a nurse. She's one of the reps who are in great favor of this. She says that there are people who are dying from diseases that they could have managed or even prevented if they weren't afraid to get treatment because of their debt. So this is certainly something that we'll be keeping an eye on at the Center Square.
Kristen, thanks for joining us today. Listeners can keep up with this story and more at thecentersquare.com.
Like to stay informed on the go? Audible has an ever-growing selection of audiobooks at your fingertips. Whether it's that classic you've been meaning to get to or the new release you've been waiting for, follow the link in our show description to get 30 days of Audible free.